If the boy on the middle of the road or adjacent to the road simply said, I love you, I want to marry with you, then how do you deal?
So,
Hi friends, welcome to my channel Lakshmi Narasimha. I am your Lakshmi Narasimha. Today one of the guests, Miss Prathima, life coach and MA psychologist, came to our village to give the interview with us. So I invite Miss Prathima madam to our channel.
thank you so much. Thank you so much. It's such a warm welcome. Thank you.
Okay, madam, can you tell you about yourself?
Okay. Hello. First of all, I would like to say thank you to you and hello viewers. This is Prathima here. I'm a counseling psychologist and career coach, and as well as I am Miss Coach. That means innermost shift coach, and I am an NLP practitioner too. This is all about me. Over to you, Narasimha.
Yeah, madam. Why people need to approach you for coaching and counseling? Can you tell?
Yes, because counseling is required when you have a mental concerns, and coaching is required when you feel that you are a lack of your own, you don't realize your own resources, and you're low with the confidence. You start comparing yourself with others' success, and somewhere you just pull yourself off from the track, getting into the mode where you feel that you're not fit, or you have a low self-esteem sort. So during that time, the coaching will really help you out, or day-to-day transaction concerns that you have, especially for the corporate people. So they face day-to-day challenges in their office. So how they are going to work with those challenges. So my coaching style is basically, it's an innermost shift coach, where it doesn't give a temporary solution. The first thing, I just go with the sessions. So whatever may be the concern, I take them to that excellence mode, a blissful state, and then make them work in their where their inner potentials, or the inner resources which they have inside the body will definitely raise up, and then they will work with a high potential. That is the motto behind. And if they have any relationship concerns with the boss, or with wife, or with family members, any one of them, so they need to have this peace and harmony state. So my coaching definitely provides them all these kind of sessions, and see to that my client is going with that kind of satisfaction. And counseling, when it comes, you have n number of problems to deal with. It is like depression, anxiety, agony, and you can say grief, you have trauma. These clients do come to me, and then though they are taking medications, they need continuous counseling. So based on the client requirement, we give sessions, and we have therapeutic interventions also, so that they can get over this kind of pain and lead a successful life, as it is it is a right of every human, I think.
Madam, can you explain or illustrate difference between the life coach and psychology counseling?
I mean, you mean to say coaching and counseling psychology? Yes, coaching is something like related to your guidelines, the day-to-day transaction that you are facing problem with. So especially I was talking about the corporate society, and then there are other people also who approach me for the coaching, because it gives you a inner motivation. It increases or boosts your motivation, to be frank. And then whereas this counseling comes in a different form, like you might have a severe mental condition where it is not supporting you to succeed in your life, which is causing hamper to day-to-day functioning of your life. Then counseling is definitely needed. It is like, for example, I was talking about the depression and anxiety issues, or it is like trauma. So in that scenario, we just connect to their past history, and try to get them to the try to resolve the present situation. But here in coaching, we don't connect them to the past history. We will just try to understand what he is going through and what he wants to work with. So it will be like understanding the person, and understanding what he is going through, and giving the relief, giving the set of goals that he has to achieve, what he wants to work with, and how we can shift his the perception, or how to shift his kind of what do you say, the problem, from problematic to the action plan, what we call it as. So in both the ways we look into a different aspect. So counseling is different than coaching.
Okay. If the boy on the middle of the road or adjacent to the road simply said, I love you, I want to marry with you, then how do you deal?
So
Will you marry with him? Will you
have
accept
seen a
his love?
smile. You have seen a smile on my face, because a person who's just proposing on the road, I worry about his mental status for first thing. And if you just leave me as a psychologist, how would a girl react for this? Obviously, I'm also a human being. Definitely, I will react, and I may not accept it. Thank you.
Yeah. Madam, in counseling, the people will offer, I mean the psychologist will offer the therapies. So what kind of the therapies you offer?
There are many therapies, to be frank. It depends upon the client problem and concern. So when they come up with with a anxiety issue, so we have main CBT, and we even use RMPT.
CBT means?
CBT is cognitive behavioral therapy. Okay, and rational emotive behavioral therapy, dialectic behavioral therapy, and we have like other therapies like motivational therapies, and it is mindfulness. So it is based upon the client requirement and client problem. So these therapies will help them out to make the good perception. The first thing is that these therapies change your perception. For example, a person coming to says that no, I am not fit to live in this world. I don't think so. I'm very confident. So people always blame me for everything. So it is called like too much of generalization, and according to our CBT. So there are so many cognitive errors within. So the people, when they come up with this kind of a distortion, we try to identify and challenge that thought process. So we will ask them for the evidences. So when he understands this thought process will not have any evidence, in fact it may be not a appropriate thought, or it is his own creation. So slowly the mind will start understanding that yes, this is not the right way to think. So basically this process is like training your brain to accept the reality. So what you think is not the reality, but there are other things that you need to accept it. So accept is like acceptancy commitment therapy. So actually accepting your problem and then working on that problem, giving it a positive thought, getting over your negative thoughts, or accepting your negative thought is also a bigger challenge for the client, to be frank. But then we expect them to do a little homework, whatever we give. So when you train your brain exactly in that way, and when it becomes like a practice to it, whatever is a learned behavior now, so they are suffering with, or the cognitive errors that they are presently going through, that will be changed into a positive. So that's a challenge that we take up. And many clients, they have come up and they turn their negative thoughts into positive. So they are working for their betterment. So it is not like a medicine that immediately a person comes in and we are giving the medicine and clearing the problem. It is not that easy. I do believe that, because it's a quite difficult challenge for a person when a behavior becomes a habit. So change that habit itself takes a longer period of a time based on his problem. When the proper person is there to guide him, or a proper person is there to monitor him, then nothing is impossible, right? So to create that kind of an understanding with the client is very, very important. So give them that kind of a motivation, give them that kind of a push, and then you can do it. And when anyone else in the world can change, I think it is very possible for you also. You can change yourself. So this is how we just motivate them, and then we take them to the reality. We try to change their thoughts and make that as a practice. So this is total package, I must say. But I enjoy when my clients say that, ma'am, I think now I'm totally changed person. I understood what I'm going through. So immediately it is self-applicable at home also. I need not tell you, but when you start doing it, on the regular basis at home, you yourself change the thoughts. That's the challenge. So most of my clients go with the satisfaction that yes, we have done the best.
For consultation purpose, how to reach you, madam? May I know?
Yes, I give both online and offline sessions and coaching as well, and I am a career counselor too. So you can consult me online and offline. If you want to consult or if you want to reach me out, I think there is a number. You can give me a call, and then I would like to fix up the appointment based on the requirement.
For example, madam, if any client who is diagnosed with OCD or depression or bipolar disorder like us, they require the therapy. So for that therapy, how many sessions is required? Whether one time or two time? How many sessions?
See, one time and two time, it is not like a medicine and he is coming to a doctor and taking the medicine and getting it cured. No, it is a mental disease. It's a mental illness, I can say. I should not be calling it as disease. It's a mental illness. So person takes a period of a time based on his severity, I can say. So if the person is taking medicines along with OCD or depression, if he's taking medicines, so it will take a little period of a time, like I can say 9 to 10 maximum sessions we would like to offer. We will see the improvement. Based on that, we will discuss with the client further how many sessions it would take. So we can't say in this particular, in these particular session we can just cure this one.
So how do you assess whether he requires these many sessions?
So after a certain period of a time, for example, if a person is improving, so we will just reduce the session. I can say that for 15 days I'm calling a client for any depression or anxiety.
So before starting the therapy,
I'll see that after 15 days, if he is reducing that kind of intensity, then it would be monthly once session. So the period will extend. So I'll see the condition of the client and then extend the session. So if in case I feel that he's perfectly fine and he can manage by himself at home, or I'll give him some kind of a tips, him or her, like some kind of a tips that he can follow. So that will be helpful after certain period of a time. So he can manage himself.
So during the therapy, before he is going to take the therapy, is a mandatory guardian, and also is there any assessment with you? I mean the checklist regarding the therapy.
Can you just come back with the question once
again?
I mean,
for example, if the client approached you before you are going to start the therapy, how do you assess whether his mental condition, whether you have any assessment?
We do.
And also besides, do you need any guardian along with him before the therapy?
Yes, of course, guardian is required because his improvement, we cannot trust our client at times because other person who is there along with him, even they notice the change. So initially when we take the case, we just take from the informant. So how is he behaving? What is he doing? So what kind of a change? I mean, the concerns from the informant point of view and the concerns from the client point of view. We take both and we try to correlate whether he is right or wrong. So patient or a client, when he comes, he will be completely incongruent with that. He will not understand what he is speaking at times. So we need a proper information. For that, of course, guardian is always required to come along with. It would be really of great support for the client also, because he can he can have an accountable partner with him. Yes, I am there. So it's a kind of a support for the client. So we have that kind of interaction with the guardian, whether they are seeing some sort of an improvement or not. And it is up to his convenience. Again, if he feels that no, it is something personal to himself and then he doesn't want anybody to interfere, so we will take care of his confidentiality also.
If the client background, the financial background is very low, then can you give the discount for that clients based on the therapist extension?
Of course, I do. I have seen many of such kind of people, and they come from a poor background, and I really empathize with them because the wellness is not that it's only connected with the people. There is no different, I mean, barricade, like, you know, I can't explain you exactly in this front because I don't consider rich and poor in this. So mental health should be everybody should know this, and everybody should what do you say, we should be reaching everyone, whether it is poor or rich. There is no difference for me. So if in case they require my help, I'm ready to help them out.
Madam, if the client approached you and he needs the more sessions, for example, more than the 10, then he comes from the poor background financially, then can you give the discount for the people?
Of course I can give, because I feel that I should be reaching more of people, whether it is rich or poor, I don't mind. But genuinely, if they are getting help through this session, definitely I would, you know, give
Thank you, madam.
discount for them.
Thank you. Madam, finally, thanks for coming to our channel.
Thank you so much for inviting me, and thank you viewers for, you know, it was such a wonderful session with you and such a wonderful interaction. I can say thank you so much once again
Welcome.
for inviting me.
Thank you.